Hi, Steve Schall from Norfolk Physical Therapy Center, and I wanted to talk a little bit today about knees. Lots of people are getting knee surgery, knee replacements, and the knee has some interesting things that it does. Now, one of the things you'll notice about people is nobody has to train people how to limp. If you injure your knee and it swells, you automatically know how to limp. And that's hardwired in there evolutionarily. When any swelling sets in the joint itself, there's a reflex mechanism and it starts to cut down the activation of this leg because it's forcing you to baby it. And that's a good thing. The problem is after surgery, you're going to have swelling in the knee and it's going to automatically want to shut down, but that's a bad thing. Now you can try arguing with your knee and explain to it that, look, before when you injured it and the swelling came on, that was bad to move it, but now it's good, so do what I want you to do. That usually doesn't work, okay? So what we want to do is, how can we get the knee moving even with some swelling in there to speed up your rehab? So here's what you do. This would be my good knee. And I don't know if you can see it, but that kneecap moves up when I tighten this muscle. So I'm going to use that. I'm going to go ahead and hold my hand right here and push the kneecap slightly down and then tighten the muscle. See how the kneecap comes up? See how it has the strength to pull up? So we'll just do that a few times on the good knee and pull up and pull up and pull up. And the pulling up comes from trying to extend your knee. I don't know if you can see my foot come up, and tighten the muscle. Now when you hold the kneecap, you don't want to hold it down from the top or that may make it grind. You want to get it from below in the sides. So there it is, so there's no compression on my kneecap. And what I tell patients to try and do is they want to tighten up this muscle. In their mind, they want to tighten it up so it's so hard that if I shot it with a gun, the bullet would ricochet off. So that's what you're looking for. Maximum tight, maximum effort. Practice a little on your good knee. Then you go over to your surgical knee, get that kneecap, push it down, and here's what you'll see. It'll be like this. It'll be fits and starts. Because that inhibition coming from the swelling is feeding through your brain, and it's, you're mentally telling it to contract, and then the reflex is saying, not so fast, slow down. So what'll happen is you'll have trouble working it for a while, but if you really concentrate, you'll find, there it is. I can make it do it. Just a little cueing of having that patella, a little resistance against the patella. You're not trying to stop the patella from coming up. You're just trying to give it a little resistance to pull against. And usually patients catch on fairly quickly, and they can really get that thing moving and starting to tighten up. And that speeds the rehab, because once you can tighten it, then you can do your leg raises and you can move on with your rehab, and it goes much more quickly. And that's something you can work on at home too. So that's one of our tips for dealing with the knees and speeding up your rehab. If you have any questions, always feel free to give us a call at Norfolk PT.